Hello and welcome to this program in the Community Knowledge Network brought to you by Vizient's Hospital Improvement Innovation Network, or HIIN. Today we'll explore the emotional challenges healthcare professionals face in today's environment, challenges that can affect a person's well-being, the dynamics of a team, and the overall culture of an organization. We'll talk about reclaiming joy in our work and how to experience again the motivation and energy we had when we began our journey in healthcare. I'm Laurel Whitmore, Associate Vice President for Performance Improvement Collaboratives at Vizient. On this program, our panel of experts will share approaches we can use to deal with burnout, foster deeper human relationships, and find a greater connection to our work and calling. We'll also hear from a Vizient healthcare organization that has undertaken a campaign to do those very things, bringing a deep sense of connection to those who had lost it. In keeping with these areas of focus, our program learning objectives are to describe the relationship between healthy, self-aware, and engaged individual employees and healthy, highly functional teams, to recognize the connection between highly functional teams and great patient experience, and finally, to identify at least 2 ways healthcare professionals can use appreciative inquiry to foster human connection in the work environment. And now let's meet our special guests. First, we have Dr. Carrie Barron. Carrie, welcome. Please tell us about your background.
Hi, Laurel. Nice to meet you. I'm the Director of Creativity and Resilience at Austin Dell Med School, and I'm Assistant Clinical Professor of Psychiatry at Columbia and Dell Medical School, and also a Certified Positive Psychology and Wellbeing Coach. I was in practice in Manhattan for 20 years, and I'm very interested in the human connection and how strong relationships with our colleagues and tenderness therein, really, humanism, can create effective outcomes.
Great, Carrie, thank you very much for joining us. And also joining us is Brett Long. Brett, welcome, and tell us about yourself.
Thank you. Great to be here and to talk about such a great, strategically important topic. So I have a bit of a circuitous route getting to this point on this topic and in my current role. Spent 20 years as a healthcare executive leading strategy and growth teams both at Mayo Clinic for a period of time and then also Park Nicollet and Health Partners in Minneapolis, Minnesota. And really what turned me onto this work was my brief stint leading HR later in that 20 years, where I realized that it wasn't really about all the strategy and having the perfect strategy. It was really about how do we harness the potential of our people and that they're connecting to their work and their colleagues in service of great patient care. That's what's led me to this topic, and it's what's led me to having a broader impact as a consultant with creative healthcare management.
Great. All right. Thank you for being here, both of you. So, Brett, let's start in on this. So, in considering the need to reclaim joy in our work, what do healthcare professionals and patients really want to get out of this?
Well, so we're getting right to the juice of the matter here, I think, which is really exciting because what we know that patients want is really quite simple. When we ask them about what differentiates a good experience from an exceptional experience, what they say is it essentially falls into these 2 categories. First is that they want to know that they have confidence in our clinical ability as a care team, that we know what we're talking about clinically and technically. But the other thing that they really want, that we often overlook, is they want to feel cared for. They want to feel that we're compassionate to their condition, to why they're here. So what we know about clinicians is that clinicians also come at the work about wanting to make a difference, to be part of a successful organization, and they also want to bring their technical skill and their technical ability. So what we're finding is that these 2 things are more similar than they're different. And what we often give patients, which is not to be judgmental, but is also to be aware of, is that we give them way more of our brains than our hearts. And so what we know that patients want is that they want all of us.
Okay, so what's getting in the way of this ideal to getting to the bigger heart?
Well, I think there's a couple things. What we know, I'm sure many of the folks watching this could put with a fine point, is this obsession with measurement that we have. It's not uncommon that I go into an organization and we go into the room and we look at their kind of visual board, they call it, and have 50 to 100 charts that are looking at different performance metrics. The fact is that cognitively we cannot take in that information. So I think obsession with measurement has been a big contributor to this. I think also the focus on quick results. Even though most of us are not in the for-profit quarterly sort of cycle and environment, we also fall trap to thinking of what is it that we can do within a 12-month period, and this work does not really allow for that to happen. It's a longer marathon as opposed to a sprint. I'd say the last thing really is that both in medicine and in our broader culture, it's really, we're really fixated on the things that we can touch and feel. And these, or touch and tangibly feel, and this work is a little bit more abstract, and I think that frightens a lot of us, and we're not sure what to do with it.
Yeah. Okay. So where do leaders fit into building this?
Yeah. So I'm a leader. I'm a non-clinical leader, and I think it's a very we're all looking at really wanting the same thing. So if we go back and we look at this sort of aggregating chart that we have in this graphic, what it shows is that, as I mentioned, the patient's point of view is that these two essential ingredients to making a great patient experience are confidence in technical ability and the compassion of the care team. As I mentioned, the caregivers also want very much the same thing. They want to provide stimulating or be a part of stimulating work, and they went into this versus another career because they wanted to make a difference. As leaders, we even us, want to have much of the same thing, which is we want to be a part of a winning team, have a great organization, to have great, excellent outcomes. But folks like us, even us, want to make a difference.
Right. Yep. So talk about, why is it crucial for us to recognize and address demoralization and burnout?
Well, I'm going to go right to a quote by Dr. Rothman from Johns Hopkins. And I use this quote for a couple of reasons. One is it's from a physician, which I think adds a lot of credibility here. And also it's coming from Johns Hopkins, which is a highly regarded organization, obviously, very much a research organization. So I'm going to read this quote. So what he says is, it's hard to imagine a more critical issue for healthcare leaders than combating burnout and attrition, because our people truly are the most precious asset, the heart and soul, and I would add, hands of our institutions. Moreover, study after study shows that happier care providers are better care providers, so this is not just a human resources issue. It's about quality of care and doing what is best for our patients.
I think it's very important to create circumstances that allow natural feelings of compassion and engagement to unfold, and leaders can really create those kinds of systems. Positive feelings are important for morale and for bonding with each other. It makes us a better team. Really affects patient safety.
Brett.
Well, and I think just to kind of reiterate this connection, I like to think of the patient experience. It's almost two sides of the same coin. Patient experience and caregiver well-being. So how caregivers are experiencing the care that they're delivering and what they're getting from that is just as important. And what we know from the research is there's a direct correlation between provider or clinician burnout and patients' adherence to their orders. So this isn't just about having a happy team whistling down the hall. This is really about hard outcomes.
Okay, all right, so this sounds compelling to get to this picture. Are we far off?
Well, so again, I'm an optimist, and I believe that it's not a hollow optimism. I think we are getting to this, and it's really been driven to some degree, I think, by the state of our burnout with our clinicians. But I think this is becoming an emerging healthcare innovation, is how we really go upstream and how we create a culture of care for our caregivers before we get right to the connection to the patient. And so I actually believe that this work is actually the next greatest innovation, or could be the next greatest innovation in healthcare, as opposed to some new piece of technology, new clinical discovery. I think this human element of how we connect with one another could be what we need.
It's so true. Our Clay Johnston, our dean at Dell Medical School, talks a lot about artificial intelligence. It's going to be so prevalent in the future. We can look things up in our smartphones. So it's really about being great humanists and having great emotional intelligence. How we talk to people, how we connect with them, will allow them to tell their stories so that we can hear important details and really make intelligent decisions with them in a shared way about how to move forward to better their health.
So, Brett, in fostering this caring culture, what relationships within that culture should we focus on?
Well, what we describe is really, as I was mentioning before, is that it's there's three key relationships essentially. So what we've done in healthcare is, I think, gone historically right to the patient. And I cut my teeth in healthcare administration at Mayo Clinic, and so Will and Charlie Mayo said that the needs of the patient are the only needs to be considered. I think what we've come to realize is that that's table stakes. That if you don't believe that in your core, you're in the wrong business. But really, as we get more sophisticated at understanding how do you get to that, we have to go upstream to self and understand that that's the place to start to create people that have self-awareness, self-management, self-compassion, and self-care. Much of those things as care providers, we're not very good at. And so we have to create this expectation, not really, it's an invitation, but it's also deeper than that. It's an expectation that people come to us with their tank full as opposed to their tank empty, and we're going to help them get there. Now, once we get that, we have them coming with, most days, I mean, we know that every day is not the same, and we've got good days and bad, but we come with most days our tank full. Then how do we interact with each other? How do we function as a high-functioning team? And we know this over and over with the research around how trust, healthy communication, and psychological safety, a relatively new term, really engages us to create the patient experience. Those two things lead us to a great patient experience.
Mm-hmm. Okay, so how important are these relationships to the patients themselves?
Well, when you ask patients, of course, they can tell you right away whether I'm with a team that gets along, they hear chatter outside if it's in a clinic environment or a hospital room, they know right away whether they can feel safe or not. And we know this also from a couple data sources. Barrel studied this and looked at the connection, as well as Prescaney. So depending on which study you look at, between 7 and 8 of the top 10 drivers of the patient experience are all about relationships. It has nothing to do with technical. And so that begs the question of, how have we gotten here? Like, what have we done to sort of abandon the 80% and really focus on the 20%?
It's so true, but if the design is right, if the organization is set up so that the work is streamlined and people can be efficient in their practice, that really facilitates those great relationships between team members and with patients. So in a sense, the design, the system, the technology is important for enhancing humanism. Mm-hmm. One of my favorite quotes is Maya Angelou, the poet. She said, "I've learned that people will forget what you said, people will forget what you did, but people will never forget how you made them feel." So we need to build those collaborative, caring systems so that people feel connected to each other and bonded, and that will carry us through difficult moments, difficult situations, and really to create great work.
Mm-hmm. Mm-hmm. So Carrie, can you take us through some of those strategies that can bring back that sense of motivation and purpose to bring the joy back to the work?
Sure, sure. So as I've said several times, relationships are a driving force. They're the most important thing. How do we create those relationships? We can have those positive synchronous moments with our colleagues. If you're passing by and you can say to somebody, you know, how's your day, or how are you doing, or how's your child, creating those connections, they can be brief but important. 5 of those a day, 10 of those a day. Having a best friend at work is a great thing, but it isn't only that. We can create a supportive, loving environment with those brief, fleeting connections that make us feel okay about our community and our work and being there.
Mm-hmm. Mm-hmm. Okay, so we've seen the patients want their care to feature compassion. So how do we foster a compassionate care approach?
Right. So compassion is different than empathy. Empathy is when you can put yourself in someone else's shoes and really identify with their experience. Compassion goes a step further. It's the sympathetic consciousness of another's distress with the desire to alleviate it. It's about doing. That's how a lot of us in medicine are. We're doers. We want to take action. We want to help. So compassion is empathy plus action. And when medical personnel are given opportunities to express their natural compassion, their calling, their sense of meaning and purpose, when the system and the design of the system allows them to do that, great things happen and the right feelings are there. I just want to take care of my patients. And I don't mean right feelings in the sense of judgment or right or wrong, but the natural sort of higher self, the beauty in the self that wants to give, that's altruistic. That's why I'm here in medicine. That comes forth, and that's good for everybody.
Okay, so there may be a few motivated individuals out there. How do we promote this to go throughout the hospital and at all levels?
Right. So how do we create a climate of benevolence and sympathy and caring and kindness and collaboration? It starts at the top with leadership, a set of values. But we can also practice what's called appreciative inquiry in the work setting. So how do we do that? And what is appreciative inquiry? It's really creating a positive, strengths-based environment where we celebrate what's great about each other. So we can put Post-its on a central board and describe the caring and virtuous acts of colleagues, things we noticed. Hey, I noticed you really went out of your way for that person, or I noticed how you held that patient's hand, or that crying mother. Observing that and letting people know, I see you, and I see the caring things that you've done. That brings a sense of community and belonging, and that engenders well-being in our caregivers. It's a value system about celebrating the goodness in each other.
So, Brett, what's your experience with appreciative inquiry, and how is it relevant here?
Well, it's really important, and this, by the way, is the work that was really launched by David Cooperrider at Case Western quite a few years ago. And interestingly, he started this work while he's not in healthcare specifically. He started this work at Cleveland Clinic. He partnered with them, and that's what gave birth to the concept of appreciative inquiry. But I liken this to essentially the same kind of work that we talk about with individual development. It's strengths-based. So if you think of anything like Gallup or StrengthsFinder, where we're really looking at how do you further exploit your strengths as opposed to spending a lot of time on your weaknesses. We know for a fact that that's a much better approach. Similarly, in organizations, if you go in, and let's just take rounding as an example, how you round and the questions you ask can make a dramatic difference. Let's just give an example. If you go in and round and say, tell me, what did you not have to do your job effectively in the last shift? Or you might even just leave it open-ended where you say, how did your shift go? Well, I can tell you for a fact from experience that when you ask those questions, you're going to get an earful. So in other words, let's think about how could you ask something that's slightly different and more sort of energy-giving. Something like, what are you most proud of in this last shift? What did you do, or what did a colleague do, or you do, that you're particularly proud of? Those sorts of things really elicit much more positive comments, and I think lift the mood. And it's not as if you're turning the door or not wanting to know what the real issues are. It's just lifting up sort of what you want.
Right. And acknowledging the strengths and championing those strengths, it really makes people feel more motivated and positive inside, so that there's an energy to go forth. It creates vitality. And I agree with Brett completely, starting with what you can do well and developing that and strengthening it. It's almost like having an orchestra. You play the violin and you play the cello, and we're all going to come together as to make something beautiful.
So Brett, given the importance of this caring culture that we've been talking about, what's driving this, the idea of a relationship moving forward?
Well, this is exciting also. I think the work that IHI has done in the last couple of years, and I will just point out that they have a white paper that's specific on joy in work, and in fact, in 2017, that was their most downloaded white paper on their website. So there's a real desire for what this work is. And also, if you look, the physician magazine, or the physician publication, rather, of the Annals of Family Medicine by Sinsky and Bodenheimer, wrote an article in 2015 that said, really, let's expand this IHI triple aim of cost, quality, and patient-centered care to really add this foundational element of joy. So in other words, how do we create joy for the people that are providing the care so that we can enable all of those other three to happen? And then the last thing I would say is that the book Advancing Relationship-Based Cultures, which is all about the things that we're talking about here, was published by Creative Healthcare and won the ACHE Book of the Year award this year.
Okay, great. And so there's a lot going on in this space. And at Vizient, we actually recently began a Joy in the Workplace initiative with our members and included a performance improvement collaborative and other resources for organizations. And we learned several things as part of this. We found 80% of burnout is related to organizational factors. And so with that, organizations must focus on removing the barriers that cause burnout. So some of those operational processes that may inhibit things, work on making those easier for the workforce so they don't have to deal with those everyday aches and pains. And also, to recognize that our personal resilience can carry us somewhere, but it's only going to take us so far if the system itself is not working properly. And several key drivers emerged as part of this work as well. The recognition that we need to evaluate our work environment. We need to listen, acknowledge, and act on what matters most to your staff because they're probably willing to tell you about it, and to develop that joy strategy and be intentional about it. It's not something that's just going to happen overall if you don't pay attention to it. So look to restructure and operationalize goals that support fairness and remove some of the guilt as part of this. Finally, look to create high-quality connections that build trust between peers, leadership, and staff. Ownership is also very important, so leadership should communicate and model expectations and to be patient with the process. We know there's a lot of different aspects of this that come into play.
Yeah, and that's really critical. I think that we have to be a bit patient with ourselves and understand that we're not going to get it perfect. And this idea of iterative improvement is really critical, especially in this work, because it could be foreign to a lot of people to deal with things that aren't technical, that aren't tangible, like we talked about before. So starting at the top and having leaders role model this work is particularly important because you can say one thing, but if you're showing another, in this work that will fall flat. Yeah. So it's really important that leaders model the work.
Yeah. Right, and just to interject, ownership is so important to really be able to say it is the system. 80% of it is the system, so the doctors don't feel that burden. Oh, what's wrong with me? Why am I not resilient enough? Why am I not strong enough? And other clinicians, nurses, all of us, wondering if there's something that we can do, and there is something we can do. There's a little bit, but it really is largely the system.
Great, okay, and we've got a wonderful example of this in action. So recently we were able to visit a team that's placed a priority on fostering joy in work. At the University of Michigan Frankel Cardiovascular Center, key members of the clinical team established an ongoing program to involve everyone on staff in their Joy in Work initiative. We interviewed those key members of the team and attended one of their regular Joy in Work lunches to see how this initiative has affected others on the team. Let's take a look.
Our unit had a lot of negative ratings when it came to things such as engagement, culture.
It was just a tough place to work, and so it was a little bit of an us against them, kind of a nursing versus physicians.
In 2016, we had, by way of the Institute for Healthcare Improvement, a broad nationwide initiative to find joy in work, and we were invited to be a site participant.
We send out emails to the staff when we initiated this to say, we want to try this joy in work, and we introduced what it was about, and then we started going on the conference calls. And we would just go into the unit, we wouldn't announce it, we'd just show up in the back room and we'd say, can we have 5 minutes of your time? So then whoever was able to come, they would come back into the conference room and we would say, okay, we want to talk to you a little bit about joy in work. And can you tell us why you went into healthcare?
Some people shared really deeply personal stories, like, did you know that I once saved a drowning victim? And that event in my teens helped me to decide that I wanted to go into healthcare. And so people, their colleagues in the room were kind of looking at each other, wow, I never knew that, tell me more.
We had a really sad story about a 26-year-old guy who unfortunately didn't have any options left and then ended up passing away. And he just got married, his wife was pregnant. It was like a very emotional and traumatic case for a lot of people involved. So Dr. Thomas was just about to get started on the first Joy in Work lunch. So he asked me if I would be interested in coming. I thought people were gonna be like, why did you pick this case? This is like not a great case. Instead, I found the opposite. I can't tell you how many nurses have come up to me to talk to me about that patient. The physicians, when they were talking about why they had done what they had done, and you saw how emotional the physicians were about it. The nurses were like, oh, I had no idea you cared that much.
When people feel safe in the room and they're able to talk about, this is why I came into healthcare, right? And we've had people speak to that, and you see the emotion come up in their eyes. And sometimes where they are is a place where they don't feel as attached to why they came into medicine. That's a really powerful thing for them to be able to put on the table and for people to be able to talk to and share their experiences. I think these are really powerful moments, and then you see other people around the table, they're inspired by that story that somebody has just shared, and then they're able to share their own story.
We've gotten to get to know the nurses, respiratory therapists, and physical therapists, and other staff that we have in the ICU outside of the ICU. So it's been able for us to be able to understand their perspective and what they deal with daily in their work.
We now have nurse-led rounds from all of those, a lot of those conversations. We had a period of time where we were one of the highest units with central line bloodstream infections to we just got our second, what they call 365-day award for not having a central line infection. We're 9 months without the pressure ulcer. So those are the things that have been affected because people are now talking.
All right, so you know, just really good work at Michigan and making some of the things we're talking about real, and it's so nice to see it. So, Brett and Carrie, what are your thoughts about what we just saw?
Well, I think what I saw in that was this connection to team and how important that was. Like you heard Dr. Thomas talk about that and how really when you connect with each other, it's really a difference. It makes a huge difference. So the more connected we are, the less conscious and unconscious bias we have. You heard him talk about folks that work outside of the ICU who historically, you know, we might have made some judgments about around their lab, getting labs back or coming in and drawing labs. So I think it's really critical, the connection of relationships to the team.
And I think that deeper sense of each other, that kind of empathy for each other, knowing each other's story, it creates a resonance and a highly functional team because you can almost anticipate when you know someone well what they're going to do next, and it makes things much smoother. So it really creates a highly functional team.
Okay, and so you know, when we talk about all of this, some of this may feel a little soft and squishy to some of the folks that are out there. Carrie, what would you say to that?
So soft leads to very hard data and outcomes. So really, it's the catalyst. The relationships are the catalyst. Everything is driven by relationships. It's the catalyst for good outcomes.
Yeah, and I would add, I think that if we think about our own experience with this, that it's when you have something happen to either yourself or someone in your family, like I have young kids, and so when I have an experience in a pediatric setting in a hospital, all of a sudden those things that I might as a very sort of left-brained thinker have thought of as touchy-feely or as soft skills, all of a sudden those are the things that actually matter in my experience. And I think there's an interesting thing to just be aware of around that tension.
So, Carrie, we talked about some initial steps to get into this caring culture. Once you kind of go through the initial points, what are the next steps?
So I think awareness that those touchy-feely things matter. I had a personal experience myself with a nurse holding my hand when I was having a procedure, and that's all I remember about that day and how much that meant to me. But so that nurse had a certain warmth that was a strength of hers. If you go to this quick survey, the Values and Action Survey that is put out by the Positive Psychology Department at Penn, you will find that there are 24 character strengths described, and it's a fun survey to take, but it's also very useful. It will tell you your top 5. And then when you hone in on that, if they're true, if you feel they're real to you and authentic, and if you can use those character strengths in your work, is that curiosity? Is that openness? Is it creativity? That puts you into a zone or into flow. When you are very immersed in your work because you're using the best part of yourself, that can provide peak moments and happiness and a strong sense of meaning and purpose being in the zone in your work, and that enhances life for everyone around you, patients and colleagues.
So Carrie, now, you know, in the day-to-day grind of going through this, we know we can't always be in that zone. So when we get out of the zone and have these moments, what are some of the techniques folks can use to get back to that positive attitude?
Right. So again, I want to say that, you know, we deal with intense things, we deal with sad things, we deal with difficulties. And so it's not about creating happiness, it's about creating meaning and also creating empowerment. So you can find opportunities for choice and autonomy, that's a very important part of wellness, where you can during the day. Who do you eat with? You know, what kind of choices can you make about the setting that you're in, and how can you control, you know, perhaps where you sit at your desk and the pictures there. Trying to work with those who bring out your best. Maybe you're really effective and free and thinking at the top of your game when you're working with a certain colleague, and being proactive about that, saying, and when you choose responsibilities that express your strengths, if you can, if your leadership will allow you to say, look, I'm good at this, let me do this, that is going to be really important for effectiveness for everyone.
Mm-hmm. So
sometimes
when we do our best to find those opportunities for choice, we're still in situations that we're not at our best necessarily. So how do we maintain a good attitude anyway?
Right, right. So there are some things, and there's been a lot of research on this. Gratitude attitude actually really works. If you shift your thoughts, you can shift mood. There's a lot of data on that. So one thing that people have really responded to, I know some of our students at Dell Medical School love to do this, and some of our colleagues too. Before you go to bed at night, consider 3 things that moved you, cheered you, or conjured your appreciation each day. And write those 3 good things in a journal before you go to bed. Creating a regular practice of this enhances well-being, and making it intentional until it becomes a habit only takes 5 minutes, maybe it takes 1 minute. It can really matter. So one of the things I love to do, to tell people to do, is create the nudge, because there is data that shows if you write it down, you will do it. You're more likely to do it. So maybe at 9:55, put it in your calendar. You're going to give yourself 5 minutes to reflect upon what went on that day, and write it, and write it. And even if you only have 1 minute, do it anyway, because it starts as a task, but it really can turn into a form of solace and self-care, and that makes you feel better, and that's better for your team, and things will go your way, and the way for other people too.
Mm-hmm. Even as you've laid it out, you know, you may get the response, you know, oh, I don't have time for that. Right. How would you respond?
Well, it really isn't the amount of time. I've always been fascinated by this, what 5 minutes can do. Actually, the writer, William Carlos Williams, he was a physician as well, he wrote about how 5 minutes of writing can actually change everything. So it's the mindset. Even if it's 30 seconds and you don't have time, just say, I'm going to go back into those positive things. I'm going to remember them. I'm going to make a point of that. And also just a slow moment during the day, if your leadership will support that. If a patient, there was a very difficult moment or a loss or something very tragic that happened, if you can take a minute to take a breath and gather, and maybe hold the hand of a team member or cry together for a couple of minutes, that's going to poise you to go back with efficiency and focus for the next task.
Yeah, and I have a couple of things. So for me, I had just a wonderful physician mentor who described how he did this. And so in his clinical practice during the day, what he would do is simply, when he would go into the exam room of the next patient, he would place his hand on his chest and he would just pause. And the mantra that he had going into the room was to just be present for this patient, for what's about to happen, and that didn't take any extra time. The other one that I like is this emergency department example, where they realized that after difficult cases, like an example of a young child dying unexpectedly in the ED in their care, they would just rush on to the next patient and they would have no time to process. And so they realized this, and one of the things that they implemented was they wrote a really beautiful, brief script that allowed anyone to take that piece of paper, convene a group in another room in the ER, and to, in a circle, while standing, read that script, honoring the patient, honoring everyone's experience of what they just went through, what they just experienced, and the work that they did, and that this is hard work that they're about. And I think that just acknowledges it in a much more sort of outward way.
Right, yeah, and it, you know, the things you're talking about sound so simple, but if you don't take the time to do it, yeah. So Carrie, you've given us several strategies on this, and I know we've broken them down. Can you walk us through this?
Sure, so let's go over them. So they all begin with C, that's an easy way to remember. There's 7 things. Connection, really connecting to your colleagues, to your patients, and creating a sense of meaning, whether the interaction is 5 minutes, 30 seconds, or longer. Connection. Compassion, sympathy and empathy with action and doing, remembering our calling. Caring cultures, a culture of benevolence and support rather than a blame and shame culture that's so strengthening. And character, why did you go into this? What is it about you? Tapping into your virtues and your character strengths so that you can be in flow and bring your better self, your best self to the work. That's going to give you a sense of vitality, and it's going to be helpful for others. Autonomy and choice. Choice is very important for wellness. A little bit of control wherever you can make you feel better, and it'll be easier to get through the day. Consideration, I think I totally agree with what Brett just said. Those moments of reflection and gathering and understanding and honoring what just happened. This patient passed. We need a moment. Let's create a ritual. Let's consider that, even if it's quick. And then again, concrete action, doing. I think many of us in this field are very much doers. We want to do something. We want to help people. And that is wellness. When you're able to do that, it's an altruism.
So how can an organization enable and encourage their staff to follow these strategies, and how do leaders foster this approach?
Right, so I think it's about leadership establishing a very clear set of values and the why. Why are we doing this? What are we about? Viktor Frankl, the Holocaust victim and psychiatrist, and also Nietzsche, the German philosopher, said, if you know the why, you can tolerate any how. Why is very powerful. So I think leaders creating a why that increases morale and bonding between team members.
Yeah, and I think that's really important that the leaders actually take this as the opportunity to focus on our people, and something that I think people resonate with. And once they know that it's genuine, you might have a hard time convincing people that it's real because it's been so absent for so long. But people resonate with that message if it's a believable message. So it's about how do we engage them and letting them know that the real outcome that we're looking for around both clinical excellence as well as compassion starts with them.
You know, patients always come first. You know, we talk a lot about self-care, but the understanding is that patients do always come first. But we have to pay attention to self-care, and our leaders need to help us do that because the culture has changed. It's very hard now to find time for yourself because there's too many emails and there's too many things to respond to, and we're all over the place. So I think leadership can help us practice self-care in the interest of making clinicians strong instruments and patients having better outcomes.
So Carrie, how will this translate to a better patient experience?
So as I said, the clinician is the instrument, and the vital clinician who's got great morale and is connected to others is going to be very, very helpful to the people and patients, people around and patients. I like to use the airplane analogy. You know how when you get an airplane and they tell you to put your mask on first before you put on that of your child's? It's the same thing. This creates quality and safety for patients when the physician and the clinician, the nurse, everyone, practitioner, the nurse practitioner, everybody feels empowered, vital, connected, in the zone, focused on the work.
Okay, so thank you, Carrie, and thank you, Brett, for sharing your perspective on this important topic. And now, before we go any further, let's get you involved. We're ready for you to join the conversation, and here's how you can do that. Just type in a question or comment online on your screen and click submit. And now we have some questions that have come in, so let's go ahead and take a look at these. Let's see, first of all, here, how would you suggest a hospital start to measure their culture on whether it's joyful? So how do you know where you stand right now?
Well, I think one of the ways is that you start with what you have, so you don't make it more onerous than is necessary. So you actually go in and pull out engagement scores that you already have, and then look at the data, and you're going to find that you have plenty of data that will give you some indication. There's some organizations that are specifically adding some engagement questions or questions about joy in work or what's getting in the way of folks doing their work more to their potential and to their licensure. There's certainly questions you can add, but I would really resist the temptation, back to my previous point about having an obsession with data, to really start with what you have. And also consider qualitative data of just going out and asking people. Spend time observing what happens without talking. Like really just being present and watching what happens for 30 minutes on the floor can be really powerful.
Carrie,
I agree with
thoughts
that.
on that?
Yeah, so I think sick days and how many sick days are people taking, because if people are connected to the work, they're really going to want to be there more often. So yes, I think that's important.
Okay, all right. And another question that's come in, can you share more about the ritual for honoring patient and staff after patient death? Any other details on that one?
Well, I think, and this is something we might be able to get to people afterwards, but I think the idea really came from the staff. So I think that's the first thing is that in this process that we were a part of, we really were empowering the folks doing the work to come up with what they thought was most important, and this is what emerged. So I think this is the power of empowerment. When you ask people what they want and what's keeping them from being their best during the day. In the ED, of course, it's a lot about tragedy and about constant sort of second victim trauma work. And so they said, we really want to implement something that doesn't take an inordinate amount of time, but that allows us to sort of deal with what we just experienced before we move on. And it's a huge team builder. I mean, when people connect like that, even in the Michigan video, when folks were you could feel the energy in their voice when they're talking about this. When people are energized and connected to their work, you feel it. It's palpable. And that's, I think, what we all want.
Every chair was filled around that table and then some, it looked like, right?
Right.
Yeah, people want to be in that room. Okay.
For sure. Yeah.
Any other?
Yeah, so I think the reflection part is really important, honoring what happened, the bonding, I agree with all that. And I think there is a human need for a ritual to really, to move us on to the next. We need to sort of close something and respect it and show respect for that patient and for what happened, take a breath, and then move forward. And that helps us really focus on the next task and make fewer mistakes, hopefully.
Right, yep, okay. Good, let's see, next question. How do you balance a work and joy approach with a disciplinary approach if needed? What if a member of your team is not engaged in their work and holds back the rest of the team?
Good question. Well, this is a tough one, and I think, in my experience, I think we're getting better at this, is to acknowledge this core belief, at least that I have, that everyone has this in them. The thing that we're talking about, the light, the energy, the passion. If you're drawn into healthcare, there's something inside of all of us, and I definitely believe that. However, sometimes that doesn't always come through, and the behavior lags, or we have poor behavior, and we have to be very firm about setting expectations of what our values are and our expectations. And if those aren't being met, what we're talking about is not soft. I mean, it is soft on one hand, but it's also getting very clear about the culture we want to create. And if you don't fit into that, we have to have a conversation and potentially separation.
Right. Yeah.
And I would also say that the truth is the best support. I had a professor that said that to me when I was studying psychoanalysis in New York, and I think it's very helpful to have benevolent and loving criticism, because it moves somebody forward, it moves the organization forward. There are ways to do it. I believe in the firmness, but the way things are delivered, I think, is very important.
Okay, good points. Okay, let's see. Next, is there a danger that productivity can drop when you develop this kind of program? Talking about spending all this time, and so what would you say to that?
Well, I think that, well, and I'm curious to what Carrie thinks of this, but I don't think it has to. I mean, we're smart enough, I think, to understand what are the things that we can sort of create in sequence and in parallel, as opposed to have it all be separate. And so, like that example I gave about my physician mentor friend that put his hand on his heart. I mean, this literally was a sort of a physical and cognitive thing for him that he did, that took no more time. So I think that there's ways to do this without necessarily impacting productivity. I will tell you though, flat out, that the issue or concern about productivity and RVU generation, that's real. I mean, so I don't want to just sound too Pollyanna about this. Those issues and concerns from physicians in particular are very real.
But you want productivity and quality. So the thing about it is if you've protected the instrument of the clinician and you've allowed them to gather or to take a minute, they're going to be much more focused on the next task. So I think that's really, really important. It's not taking time away. You know, I once had another colleague who said, when I was in medical school, and he said to me, no matter what you do, always sit down next to the patient by the bedside. And even if it's for 10 seconds or 15 seconds or 30 seconds, it's conveying a certain set of values and it's conveying caring. So it's less about the time and more about what you're communicating with a certain kind of value system and behavior.
And you know, in the video from the University of Michigan, we saw some of that play out, right? They were talking about fewer harm events, truly, as part, and they attribute that to this work. Good, so lots of gains to be had. Another question, if burnout is 80% from the organization, how do we help the organization move to fixing this when I'm just a clinician? So this is that, you know, that leadership, the overall culture. You know, you have a few motivated individuals, but how do you spread this?
It's a great question, and I think one that we're all trying to figure out, because even though we've got this emergence of data and the publications that are coming out describing the importance of this and connecting it to clinical outcomes and patient experience and HCAHPS scores, which all now have real revenue attached to them, there's still a bit of a gap in terms of when you ask. Actually, there's data on this. So when you ask executives what is well-being of your clinical staff and your whole team important, they say without question, absolutely. But then when you stack that well-being and culture against all the other priorities around financial and other things, it drops considerably. And so we have to understand, what is that about? Like, what is getting in the way of us recognizing the impact and why we shouldn't invest in this?
And the thing that I would say about that is that often when we think about wellness programs or wellness culture, we think sleep, we think nutrition, we think exercise, we think meditation, we think mindfulness. All those things are really important, but probably the most important thing is relationships and how we treat each other. So if leadership wants to know of an intervention that isn't, let's stop and go to the gym for an hour, let's think about our values. Let's think about how we talk to each other, how we communicate, the words we use. That's not going to take more time. It's just a shift, a choice about how to relate to one another that can make a huge difference for everyone.
Okay. All right. Another question here. This one's a little long. The hospital I work at is aware of self-care and resiliency and has taken steps to provide some activities accordingly. But on a specific department level, my department leader seems to either have no idea this is a problem or doesn't care. Any advice on how to close this gap?
Wow. I mean, this is hard. I mean, this is and this is very common. I think, as we know, leaders are critical in this, and as Carrie mentioned before, it's got to start at the top, and executive leaders, modeling this behavior, because, I mean, what we're talking about is very real human-to-human connection, and if the senior team cannot model that, then we're going to have a problem sustaining it going forward. But in this case, when you have a leader that it's even been an organizational priority, I'll say, or I'll assume, and you have a leader that's not getting it, middle management is critical in this and very, very important. And so I think keep fighting the fight, but I mean, however you're comfortable addressing that with that person. Of course, I always encourage people to deal directly with that, but it can be challenging.
Right.
Right, so what I would say about that is that from my understanding and from the great leaders are great listeners, and they're receptive, and they're great problem solvers. So to do that, you really have to hear the truth of what's going on and be receptive to it. And it's less about, you know, the speeches and the dictates and more about what you create in terms of the environment and the feelings that people have about being there. So I would say how to practically approach it. I think if you're afraid to approach it, and find support somewhere, but know in yourself what the truth is, that it's 80% the system. If you know that truth, that can maybe give you some strength.
Okay. Good, thank you. Let's see, another question. A lot of great ideas in discussion today, so thank you for that comment. And question is, what would you recommend to do first just to get started? Thank you.
Yeah, it's wonderful. And I think this is a really critical point. I mean, what's the next step? Okay, so we've had all these great conversations, and I am a pragmatist and have spent, most of my career leading teams, and so I really appreciate this comment. So I think one of the things is to assess. So understand what your current state is and get your folks engaged right away. So ask them and pull in, because what I have found is that people have rushed into solution creation very quickly without engaging their team. And it feels sort of like people are left out, or that's very misaligned with what's really happening. And so I would say, if you're comfortable, go in and into the sort of chaos a bit and disorganization and ask people, how is this for you? What is it like to practice here? What are the things that we should be focusing on? And we know this for a fact that, particularly with physicians, they say, don't do anything about me without me. And so make sure that I'm engaged in creating that plan, as opposed to coming in and throwing down the strategy and saying this is the roadmap.
I totally agree with that. Meet them where they are. I think it's talking to people. It's starting with that. Let me hear what's going on with you. How are you doing? What's working for you? What's not working for you? I mean, I think, but all the while emphasizing the positives in that person, because you're going to, I think, get the most out of the situation if you do that.
Okay, great. Let's see, okay, another question. We hear about coaching going on in hospitals now. Can you tell us a little more about the role of coaching?
Yeah, so I'm happy to talk about coaching. So coaching is again, a strengths-based intervention, and it's goal-oriented, and it has to do with really understanding your reality and how you can move within it. I don't know of anyone who does not feel depressed at times, or anxious at times, or worried. I don't know of anyone who doesn't need an ear sometimes, or a support. So I don't like to think that you have to be pathological or there's something wrong with you because you need to talk to somebody. I think everybody needs somebody to talk to, and it's all about finding your own strengths, really, and also honoring what's troubling you, or what you're crying about, or if there's a true sadness or a true depression or anxiety, that's okay too. There are other things that can be done about that, but not holding it all in, I think, is very, very important. Reaching out to someone, and I think coaches can play a great part in that.
Yeah, and I've seen it work really well in places. And now I'll admit that most of the places that have had success that I've observed have not been mandatory. So they will go to physicians in particular. I'm thinking physician coaching, and they'll say, here are the data, and we're seeing patient experience scores that are consistently low for you. And they give them some encouragement, but they say, and we offer coaching. And so I've seen that really be a great impact, particularly when the physician's reaching out to the coach for that help and support. And the shadow coaching, which is the most powerful, when they're right in the room with them. Because I think that's where the magic happens and where they can really get into the real work.
Yeah, okay, good, okay. Thank you. Let's see. Another question, is this mostly an individual effort or systematic effort, or both?
I have an opinion about that. So it's both. It's absolutely both. And so what you don't want to do, and I'm just thinking of, again, physicians, but it applies to everyone, is that you don't want to go into folks and say, hey, this is your problem, and that you need to fix this. If you would just be more resilient about what we're doing, then things will all be better. I mean, that's not true. But I also don't want to let all of us individually off the hook, because we do, as I mentioned, coming to work with a full tank every day is my responsibility. That's not your responsibility or yours. Yeah. So I'm a part of this. But the organization has a huge role to play. I mean, as we saw, 80% is what's driving this mostly. So of course, process and things that all get in the way are something that we have to address. And I believe that a lot of the lean work that folks are really engaged in can be a great help here too. If we just focus some of the lean efforts on what's getting in the way of people's processes as caregivers, then again, we get a twofer out of this.
Yeah. And I wanted to agree with that as well, but I think mindset matters and the system matters. So I agree it's both. But psychologically speaking, there's a set point that people have for happiness, but you can shift. I think it's 40% of it with mindset. So if you learn gratitude, attitude, and you practice some of the things that we talked about today, those are things that can really help you, but always with the knowledge that we have a system that needs to be worked on, and we have to really own that.
Okay, all right. Let's see. Question here is, let's see, to Carrie, I think, is any of this happening at your organization?
Right, so we're doing a lot to try to enhance well-being at Dell Medical School. We've instilled coaching, so we do have that. We have that for our medical students. We do a lot with the humanities. We have writing courses. We have that for our faculty. It's also available for the residents. One we've had is making sense of clinical experience. That can be therapeutic. There's healing through writing. There's connecting to other people through your writing, and so those are some things that we're trying to do at Dell. There are other things we have lectures and didactics on wellness, but I think above all, our deans Clay Johnston and Sue Cox are really about changing culture. The motto of Dell Medical School is rethink everything, and we pay a lot of attention to taking care of each other, and I think people really feel that. It's a great place to work, and I feel very lucky that I can be part of that and contribute to that in whatever small way I can.
Mm-hmm. And just a side question, what about other organizations that that you're seeing this at? Where else are we seeing this happen? And
I think there's a number. I mean, we were talking about this earlier, but I've seen work being done. Of course, Stanford is, I think, publishing a lot in this domain, and Tate Shanafelt really from the physician side, going from Mayo out to Stanford to lead their physician well-being. But also other pockets. A group, Christiana Health, out in Delaware, it has really done some amazing work to try to really capture how important this is, and they have a physician well-being champion and leader who's been doing this work for 6 years. You see a group in Michigan, Mid-Michigan Health, based out of Midland, that's really focusing on bringing physicians in and looking at how do you create a cohort environment for them to lean on each other for. So there's definitely action being had, but I think it's really important, though, in this case, to understand that a lot of this is experimental. I mean, there is no playbook, and so the most important thing is to understand to prioritize it in its necessity and taking a first next step.
Yeah. And you see it in the literature. There's articles about humanities coming out all the time, and processing emotion and how important that is for our patients and for ourselves. So I think it's becoming more of a regular way of practicing, but much more work needs to be done in terms of really owning it and making it happen.
Okay, all right, great. Thank you very much. So we're at the end of our program, and we hope this has encouraged you in your efforts to bring joy to your workplace. Before we go, we wanted to review our objectives and what we've covered in this program today. So the first objective, as you recall, is to describe the relationship between healthy, self-aware, and engaged individuals and healthy, highly functional teams. Carrie, can you review our key points on that?
Sure. So insight sets you free, the truth sets you free, and understanding who you are and how you can be most effective and joyful is really, really important. It also helps you communicate better with your coworkers and work with them in a more empowered way.
All right, thank you. And our second objective is to recognize the connection between highly functional teams and great patient experience. Brett, can you take that?
Yeah, and as just in summary, I think what's most important here is that how we function together as teams is very much felt by the patient. And so how we connect with each other and we come in with our tanks full, we figure out how we can create an environment of psychological safety and trust. All of that translates to the patient, absolutely.
Mm-hmm. Okay, thank you. And finally, objective number 3 is to identify at least 2 ways healthcare professionals can use appreciative inquiry to foster the human connection in the work environment. Carrie, can you take that?
So in a concrete way, you can have a board and you can put Post-its on the board that acknowledge your colleagues for the virtuous things they've done, when they've been in flow, when they've been effective, what you've noticed and observed. That is really great to be seen and to be acknowledged for some of the things that you do. silently. And that's the concrete way, but also just, you know, going out of your way to say something good to somebody. Hey, I noticed that you did this, and it moved me. And sharing that can really help somebody. It can make their day.
Great. Okay, thanks to both of you very much for being here and truly on this phenomenal discussion on this topic. And thank you for sharing the work that you're doing. And really, you know, to bring back the initial point, Brett, that you made, you know, there really is a lot of innovative work going on in this non-technical space. So thank you.
Thank you.
And also thanks to those at the University of Michigan who allowed us to interview them on camera. And thank you to you for taking time to join us today. We appreciate your participation. And don't miss our next program. It's on Tuesday, March 5th, 2019, and we'll be covering the latest on diagnostic error at this same time slot. And now from Vizient, I'm Laurel Whitmore. Thank you very much for watching.